Bizarre medical legal cases part 11. So this one we call ulcer or ulcer. So this is actually the most common nursing home case that we get. So we have to evaluate pressure ulcers. And again, this can happen to any human, but especially the elderly, the frail, especially if one is bedbound, then they develop pressure ulcers, which basically occur due to bony prominences like the elbows, the coccyx in the back root sacrum, the heels, even the ears. And so the thing is, however, not every pressure ulcer is a pressure ulcer, right? So some of them are called Kennedy ulcers, which is also known as a harbinger of death. And so our job is to basically determine what are actual pressure ulcers due to medical negligence, like lack of repositioning, versus which are signs of death, which is very fascinating. And you can learn a lot about just pressure ulcers. Bizarre medical legal cases, part 12. So this one we call sudden death heart attack. And all of us in the healthcare fields know that there are many types of heart attacks. Heart attack is just a colloquial term. Cardiac arrest more so, but also myocardial infarction are more apt. But there are quite a few. There's STEMIs, there's NSTEMIs. There's a lot. And the one that we hate in the medical legal field, or we don't hate, but like it's very fascinating, is called a PEA. So a PEA stands for pulseless electrical activity. So basically, whenever we see a documented PEA, it's very difficult to establish medical negligence because these are in the category of sudden death diseases. So basically, it's a symptom that we can't really predict, and it's a sequela of many different diseases. Bizarre medical legal cases, part 13. This one we call buff, but at what cost? So this was one of our more amusing cases. So a client basically he wasn't the client, it was a hospital. So the hospital basically stated that the client was self-administering anabolic steroids into his shoulders. No clue why, obviously just to get buff or whatever, but that's a very silly place to inject anabolic steroids. And also anabolic steroids are horrible, don't take them. But anyway, so it led to rotator cuff injury and osteopenia, and basically osteoporosis. Like we don't have definitive proof. There was no DEXA scan, but we suspect because his shoulder was just dead. And so he basically sued his orthopedic surgeon for not dealing with this, but obviously this was self-induced. So bizarre medical legal cases, part 14. So this one is a little bit more serious. So I call this a nightmare without end. And it's all of our cases that deal with ODS, or osmotic demyelination syndrome. So highly recommend or not to Google ODS and to watch videos or learn about it. But basically what happens is an inappropriate correction of sodium, which basically leads the neurons to have an osmotic deficit. And so this can lead to entire body paralysis. And so the only thing that one can experience is something called locked-in syndrome, where they're aware, they're conscious, and they can move their eyes, but they can't move the rest of their body. So for these cases, we have to recruit a nephrologist, a kidney doctor, to basically ensure that the doctors and the nurses corrected the sodium correctly. And unfortunately, a lot of times we don't. Bizarre medical legal cases, part 15. This one is simply called hot-blooded. So it was I believe she was in her 30s, like a pretty young female, and she basically just stated that she runs hot all the time, and she wouldn't really tell her physician, her PCP, but yeah, so she was extremely slim, and she was actually self-conscious about being slim. She would sweat a lot, and she mentioned it to her PCP a couple times. Nothing was really done, but then after about a year or so, when she started developing a neck mass, goiter, then the PCP finally ran a thyroid panel, and she was found to have hyperthyroidism, undiagnosed for many years. And so she basically sued her PCP. The case is still ongoing, so we'll see where it goes. Bizarre medical legal cases, part 16. So this case we call Check the Pipes, and it's a tragic case that involved an 11-month-old female little girl. So at 11 months, she was diagnosed with hydrocephalus. Hydrocephalus basically means an excessive amount of cerebrospinal fluid in the CNS, and it goes down to the peripheral nervous system sometimes. And basically, she had two shunts installed, so it was two pipes. And unfortunately, these two pipes were mislabeled. So one was removed, the other one, which was supposed to be removed, was not. And so this led to further hydrocephalus, and it also led to bilateral cerebral artery strokes. So then the poor little girl suffered profound blindness, extremity weakness, and multiple functional disabilities that she'll have for the rest of her life. And she's currently, I believe, 1.5 years old. So we had to recruit a pediatric neurosurgeon for this case, but tragic. Bizarre medical legal cases, part 17. So this one we call a sightseeing screw. And it's actually quite a few of our orthopedic surgery cases. So after major, hip fracture or femur fracture, orthopedic surgeries, they use what are called titanium screws to basically replace, or basically reinsert bone fractures. And so sometimes if these screws are not screwed in the correct distance, they can actually migrate into the tissue. So I've actually seen radiological imaging where there's a titanium screw in muscle, like just lodged in muscle. So as a general medicine physician and medical legal consulting doc, I have to basically list out the sequelae from this, or the after effects. So one of them is infection, the other is just musculoskeletal pain. So if you ever go through a surgery like this and you suspect something happened, just go back to your doctor and get an x-ray. Bizarre medical legal cases, part 18. So this one we call Where Did It Come From? So basically, the toughest part of infectious disease medical legal cases is to, quote, identify a source of infection. So what's funny here is, and this is really why I love being in this field, is because in the medical field, we don't care. Like, of course, there's healthcare associated pneumonia, community acquired, blah, blah, blah. But in practice, we don't really care as doctors and nurses, right? We just want to we just want to get rid of the infection, help the patient return to baseline, go home. That's really the point of being a practicing physician or nurse, etc. But in the medical legal field, it's tantamount to know, okay, who should we punish? Who should we sue? Who did not engage in infection protocols, right? So we sometimes have to say things like 75% likely to be in a nursing home, 20% of it being from a neighbor or a relative, and it's sometimes very difficult. Bizarre medical legal cases, part 19. So this one is for all the men and the boys out there. And some of you might be happy about this, some of you might be very upset about this, but it's regarding the dreaded PSA screening. So we call this to test or not to test. So PSA screening is a very controversial test because so prostate specific antigen, it basically checks for the likelihood of having or developing prostate cancer down the line. However, depending on which school of medicine you're in, either family medicine like myself versus internal medicine versus the Academy of, urology, everyone has different guidelines. And so right now, per the USPSTF, which is basically our screening guidelines, and it's 2024, it's probably going to change next year. It's under the category of like really shared decision making because the false positive rate is just so freaking high. You don't want a guy to get urinary incontinence, anorgasmia. Yeah. Bizarre medical legal cases, part 20. So similar to yesterday's video, this one is also called to test or not to test, but for the women and girls out there. So this is on breast cancer screening, more particularly self-breast exams. So again, when I was I sound like an old man, when I was in med school, when I was in residency training, self-breast exams were highly recommended by the USPSTF. And this was just a couple of years ago, and as of 2024, it actually recommends against self-breast exams, which I personally, as a family medicine doc, I think it's insane. I think it's always smarter to test things yourself. For testicular cancer, always check your testes, men. Women, always check yourself. But again, this isn't medical advice or anything. Follow the USPSTF guidelines, but we get cases every week about this since it fluctuates yes or no to screen or not to screen.